Hello, my name is Matteo Berlucchi, and I'm the CEO and co-founder of Your.MD. And I'm really excited to be here today because I can share with you our dream of giving free healthcare for everyone forever. What do these people have in common? Across space and time, these people need one thing. They need health advice. And this advice needs to be personal, trustworthy, and actionable. And we need this advice because our bodies are the ultimate black boxes. Even if we carry them with us all day long, we know pretty much nothing about them, or very little. So there's only one person that knows about health, and he's the doctor. So we have to go to the doctor because they are the repository of this information. But the problem is that there's not enough of them. There's a huge demand and supply problem. Even in developed countries like the US, and even more so in developing countries, the lack of doctors is just getting worse. An estimated 2.5 billion people have no direct access to healthcare. So the key idea behind Your.MD was the realization that health knowledge is the single most important factor in improving healthcare. Healthcare is an information problem. 90% of visits to a doctor in the UK are for minor conditions, and up to 80% of these conditions could be sorted out on your own at home if you had the right information. Unfortunately, the alternative is only Dr. Google today, but Dr. Google didn't go to med school, and the problem is that their algorithm is not designed to understand you as an individual. So if we all type in the same symptoms at Google, we'll all get the same conditions. And there's no real guidance and trust in the content that you can find. So what you need, and this is what we built, is an artificially intelligent personal health assistant that can understand you individually, your individual problems, and give you the best possible health information. So we built a platform that understands what you say, your problem. It can guide you with very trustworthy health information, and if needed, it can connect you to third parties that can help you sort out your problem, like buying medicine or seeing a doctor. So the first thing we had to build was a smart natural language processing component that could understand whatever you say and transform it into medical language. We then realized that nobody had built what I call a map of conditions. Nobody had mapped all the relationship and the factors that make a doctor able to understand what is your potential condition. This is a huge job. It's going to take many, many years. We started and we had to crowdsource the information from doctors because there's so many data points that you cannot do it very easily with a small team of doctors. And then we built an AI brain that can understand you as an individual and make sure it asks the right questions and narrows down to the potential condition that you may have. At that point, we need to give advice, and the best advice we found in the market today is from the NHS in the UK. They wrote this fantastic set of information that can be given to people to decide what to do with their own condition. This is an example of how Your.MD would understand that you're potentially gluten intolerant, starting from swollen hands and bloating of stomach, which if you try yourself on Google today, is not going to be even mentioned as a possible condition. So our business model is not dissimilar to Google, and is to essentially become a marketing platform for health services so that we can direct people with a particular condition to the right providers to help them sorting out their problem. So we're creating a trusted health marketplace. This is an example of how we're integrating the partners in the service so that, again, people can find trusted service providers that don't sell them fake medicines and they don't potentially steal their credit cards. The service doesn't need a user interface. It's chat-based, so it's actually available already on Facebook Messenger. We're one of the 30 approved bots on Skype. We're on free basics in India and Africa with Facebook, so users don't even have to pay for the data. The biggest dream for us is to have this amazing social impact, both in developed and developing worlds. In the developed world, we can help millions of people self-care, reducing the pressure on the national health services. And in the developing world, we can help local health workers be much more effective by using this assisting technology to enable them to be more accurate in the healthcare they deliver. We have already more than 1 million users. We need everybody to help us because we use machine learning from all the data we collect to improve. It's a very big task. I think we have one of the best systems in the world, and we're very excited about what we're doing. Thank you very much.